at the end, and my EKG leads have one inch longer size, so they're different too. So what you're gonna do, you put the final one here, and the rest you put like them in a one kind of bundle like that, and secure them, so that way they're gonna stay all together. Okay, and then when you plug the system in, you need to make sure that the wires are not removed, so during the recording, because there are going to be a lot of things going on with the patient, you just so this will be the end this way, so you place it to this side, make sure that the wires are on this side, because when you're gonna wrap the thing after the end of the study, you can go on the back side and cut it through, knowing that there are no wires from this side. So you wrap the box like typically all around, and go even under the straps, doesn't really matter. Okay, so everything is secured, that way the case is gonna be really good in quality, and it's gonna last really long, up to 2 weeks without a problem. So that's pretty much ends my presentation with a basic technique how to set a long-term epilepsy monitoring, and
and this also is good for ambulatory,
yes,
because it's more
right, yeah,
secure.
Right. The only thing what I want, actually, I'm wrong. I want you to show other things. Sometimes you have a patient who are combative, and sometimes you don't know what patient gonna do. So it's a good technique, typically on pretty much everyone, just to seal the face, and I'll show you what I mean by saying it. So, because patient unintentionally can get under the wrap and start to mess up the wires, so you don't want that to happen. So what you need to do, you need to take this hyperfix tape, and you just adjust a little bit the face, and you put it right here. You put another tape on another side, you adjust again on the patient, so that way it's going to be comfortable, so it's going to cover. And okay, so now I'm sure that I cover pretty much everything. So again, like these wires, I have a little bit of space so the patient could move around. Okay, and sometimes if you see that the hairline here shorter, the patient don't have a hair here, you could put a little bit thicker tape on the bottom right here. Because I mean, you see that like one wire is here like sticking out, so you probably don't want it to happen. So you put it, probably you tuckle it in, and sometimes you could put one like here. You could put one on this. And again, sometimes if people have a short haircut, then you could put the whole line on the back, and you can secure this end. So now it's pretty much you secure everything as much as you can. Okay, so the patient is ready to be monitored. Okay.
That's great. Thank you.
You're welcome.
Is it good for the long term process?
It's good. It's a proven technique. It's as I told you, it's gonna last at least 2 weeks without a problem, and the patient is pretty comfortable. I mean, Dr. Strayhorn doesn't feel any kind of discomfort or any kind of thing.
I used to wonder how people could be asleep at the beginning of a recording. And now.
Well, this is out of my scope of presentation of it. I mean, people get used to different things in the hospital.
My question is, what are the patients suitable for this sort of procedures? Because all the patients, they won't accept this procedure. First,
right.
When you show the video only, they will run.
No, I mean, when you do a patient in an ICU, of course, it's going to be different. So you have to know how to do the wrapping technique on a sitting base and on a laying base.
Yes.
So when you do it on a laying base, you need to lift up the head,
yeah.
Go under the head around. So it's more difficult, it's more time consuming, but it's doable.
Yeah. And the intubated patients and there's so many suckers and so many things,
you need to
and
go,
everything
you need to go all around the lines. You need to go all around the lines. I mean, sometimes patient could have a collar here,
yes.
which really like be difficult to apply electrodes, but you have to work under different conditions accordingly. But I just give you a presentation on a normal outpatient setting today.
This is good for the outpatient long-term stay for the epileptic assessment for the chronic patients continuously on drugs and monitoring, and they will counsel and they will suitable. They will accept this procedure. Then we can do it this way. But in our setup, day-to-day life, whether is suitable day-to-day, whether in the ward.
Right. Okay, so let's start to take everything out. The Dr. Strayhorn, and actually maybe I'll show you the way of taking it out. It's going to be good too, because that way you know.
Yeah, really good. You know, we can keep it even 1 week or more than 1 week.
Right. So let me show you how you can do it. How you can take it out with ease and quick. So that way it shouldn't be a problem. The only thing which I didn't bring here, but we probably should consider it. There are some patches like a nail polish remover patches, which
we had those downstairs.
Yeah, so you could use these patches just to help, especially on the hair part. So what, in order to remove, you pretty much you have to go first of all take this away. This is what I typically start to do. I take this away from the face. Okay, when it's, let me start to bring
good look.
A trash can here. So I can start to. Now you will be able to get through. Typically use this kind of scissors, so you're not gonna with a dull end, so you're not gonna put your fingers and cut. Okay, so same like here you take this one away, and you cut. So you're pretty much done with this part. Let me just take this tape out. Okay, so now you can take a little bit off, and now you see that these wires are really set well. So you have to take this away. This is the most difficult part. You just to take this and then you can take the whole thing out. Okay, take this EKG pads off. Okay, now you take this and pull it from the, and you see from this end you can see that there are only paste was against the patient's skin, so the whole other parts of the wire was covered by this wrap, so that That's important. So you put it away, and the rest is easy. You're gonna pull them all at once, and that's about it. So complete removal of the cotton squares, and then patient can go and take a shower. So that way we cover everything from A to Z. We did head wraps, and we remove the wires. So now I think this is the one.
Yeah, Jane's not there?
On this side. Yeah.
Alright, let me call him.
Okay.
Okay.
So that's about it. Alrighty. So Dr. Strayhorn, you survived all my tortures. Thank you for being patient with me.
I did survive.